Today we are going to be talking about three things that are literally interconnected in a way. The first is doctor patient relationship. Now, if you ask me how the doctor patient relationship in Nigeria especially is, I would say that it is more parasitic than it is symbiotic. I don't want to hear that being a doctor is a calling. If you have that mindset, please go and watch my other videos. Yes. So yeah, we are doctors. We are being called to do what we are doing, but it's still a job. And we are being paid to do what we do. Fine, we have the whole idea of caring for patients and all of that, but we are still being paid to do it. So a symbiotic relationship is that you call me, I do something for you, I pay, or you pay me what I'm worth. So I go with the pay. That is a symbiotic relationship. But a parasitic relationship in this case means that you call me, you want me to do literally every freaking thing. You want me to be at your beck and call. You want me to be at your bedside literally 247. You want me to attend to all your calls and everything. And then you pay me peanuts for what I am worth. Like, you do not pay me what I'm worth. You pay me literally literal peanuts at the end of the day. I want you to describe that in your own words. Is that not a parasitic relationship? And I feel that is how the relationship between doctors and patients are in Nigeria. I've not gone anywhere else in the world yet to see how doctor patient relationship is over there. But I can tell you from my experience working in this short time, this is what exactly what it is. Another question I want to ask is, how far should a doctor go in caring for his or her patients? There are a lot of doctors that want to do the barest minimum. They just want to care for their patients and go, like, do whatever it is that is expected of them to do and go. But we all know that if every freaking doctor in Nigeria starts to treat every freaking patient that same way, a lot of patients are not going to make it. A lot of patients are going to be worse than they are, because the healthcare system in Nigeria is not properly structured to benefit both the patient and the doctor. A lot of facilities in Nigeria do not have what it takes to care for every freaking patient. So if every doctor wants to do what is in their job description, just do what I'm supposed to do and go home, a lot of patients are going to have issues. So there are those doctors that just do the barest minimum and go, and then there are the other doctors, maybe out of fear or whatever it is, or out of the whole being a doctor is a calling and all of that, want to go way and above for their patients. End of the day, after going way and above for their patients, some of them end up having legal issues. This doctor did this, he's not being he wasn't he did this that he was not supposed to do, he bypassed this process, and it resulted in this, and for that I'm suing him. He has to pay this fine, his license has to be withdrawn and all whatnot. I understand that, yeah, that is the way you feel. But now put yourself in the situation of that doctor. He's being called to do what he's being called to do, and at the end of the day, the results did not turn out the way it was supposed to. Or yes, it turned out the way it turned out, and the patient did not make it. And then you, as a patient relative, you're now inflicting your anger and all what's not on this doctor that literally sacrificed his time, sacrificed his efforts and his resources in order to, most cases, sacrifices his resources, the small resources he has, in order to see that his patient is well, all just to do the one duty that he was called to do. Now these are the contrasts that happened in the Nigerian society. And in this on this channel multiple times I have warned that no doctor, especially young doctors, I know you want to be kind, you want to do things for your patient, but in most cases, trust me, when push comes to shove, that thing you feel like you went way and above for your patient, when it comes starts to backfire, trust me, you would have nobody, even the hospital management that says they are going to literally stand by you. You're going to find yourself very alone. If you see a patient that is in need of a particular care, you have to do everything you have to do in order to care for that patient, but not when it goes beyond medical ethics. There are some rules and whatever principles that guide your medical profession. Do not do not overlook those rules in order to help somebody, because if push comes to shove, trust me, they are going to throw you under the bus. Now, there's another factor of violence and harassment amongst or against doctors. Yeah, I think that's a better word, against doctors. In the light of the whole thing that happened with the University of Uyo teaching hospital consultant and all of that, I want to take us back because these things have been happening over time. They've been happening numerous number of times and nothing fixed have been done about it. That is why they could go to this extent to inflict such harm. You're literally caring for a patient and someone else comes to attack you, the doctor, caring for a patient. And I feel like the more we let go of the lesser things that had happened in the past, the more people feel like they can do anything and get away with it. Like if there been no consequence for any action or harassment of any doctor, the more issues like this are being raised, the more terrible things. You might be surprised, Seth. Even the theater that you think you're safe in, terrible things will just keep happening, and you can start asking yourself, where exactly is this coming from? But then what happened to our medical elders? Like, what can we do? What can you help us do to ensure that these things never happen again? It's a huge slap and embarrassment to the profession. If maybe something was done to you and you want to take legal, you want to come at a doctor or something like that, is that the best way to go about it? Is taking his life or harassing him or breaking his leg or doing all manner of things, is that the best way to go about it? I don't want to say that we're living in a very lawless society, but this is the height of it, honestly. Back in the day, we're being told that not we, maybe our seniors too, were being told and try to stay in Nigeria. We need doctors, we need specialists and all whatnot. We need them to care for the other patients and all of that. If you go, who is going to care for? But now those chiefs are still the one, are now the ones telling you, if you want to japa even earlier. Do you get? Like, if you want to japa immediately after medical school, plan your this thing and go. That is what they are now telling you. So it's a very terrible thing. Like, all these things are literally interconnected. From parasitic relationship, now it's normal. It's a normal thing. You expect us to overwork ourselves and get peanuts for it. Fine. And on top of that, you now still harass us for doing our duty. You now still harass us for maybe something terrible that had happened in the line of our duty. If this can happen to a consultant, to a surgeon, oh God, oh my freaking God, who are you as a house officer? Like, let me just paint this scenario. Who are you, freak? And the terrible thing that happened was that a house officer died not too long ago. Like, the life of somebody was taken prematurely from him just a couple months, a few weeks ago, and now this is happening. So where do we halt? Like, at what point do we stop, and at what point is something done about all of these things? I don't know. I'm just here blabbing at the end of the day. But if you don't take anything out of this video, especially for you as a young doctor, you as a house officer, you as a freaking medical officer, wherever it is you find yourself, if you sense that a patient relative or a patient is becoming violent or aggressive or threatening to be, it mustn't be that the person has started though. Like, if you sense that the patient is trying to be aggressive or violent towards you as a doctor, remove yourself from that situation as quickly as possible and report to the nearest security. And if you must attend to that patient, don't do it alone. I get it too. There may be times that maybe you're being pushed or you're being stretched so much Before you can even start being vocal with your patient and all of that, just take a break. Tell the patient that you're going to come back later, or refer the patient to a different doctor. You can't be the only doctor in the entire hospital. If you know that you do not have the capacity to manage a particular patient and a situation, just refer to another person instead of you getting to the point of being aggressive or violent, or start exchanging words, or creating a window where a patient will have an excuse to start being physical with you. Please just avoid the situation as much as possible. God is going to bless our practice. Honestly, God is going to freaking bless our practice, but we have to be alive to tell the story of Him blessing our practice in the first instance. I know crazy things are happening, especially in the healthcare system. A lot of crazy things are happening, so you should be able to draw the line where you stop going or cutting corners for your patients. You should be able to draw the line. You should be able to communicate clearly with your patients what you need to do. Let the patient understand and let it be the patient's decision. Is this what you want us to do? Get consent and go ahead. I shouldn't be working in fear. I shouldn't be discharging my duties in fear that maybe one day I'm going to be attacked or anything. No doctor deserves to be mishandled or be harassed in the line of their duties, in the line of their job. Honestly, this is literally all I have to say in this video. If you haven't subscribed to this channel, subscribe. Subscribe. Honestly, I'm going to catch you guys in the next one. Yeah, more beautiful things coming your way. I know it's been a very long time. Yeah, I took you guys along because of my job and everything, so maybe we might just try that. Currently I'm in the outpatient department, so yeah, we might just try that and see how. Let me do a, should I call it a mini vlog? A mini vlog, sorry. Yeah, I'll attempt it. I'll try to attempt it. Yeah, I'm going to catch you guys in the next one. Peace.